In less than 24 hours, COVID-19 will no longer be considered a public health emergency. The U.S. is following the World Health Organization after it announced similar steps last week. News 8 Now's Dua Israr takes a look back on how the pandemic changed the lives of people in the Cooley region.
Ken, the pandemic isn't the only thing that's ending. Many state and federal pandemic aid are also in the process of phasing out. That means catching COVID-19 now may cost your wallet extra.
This is not a time to panic. This is a time for preparation.
It was a year of uncertainty and fear.
We have been notified as of this morning of our first confirmed case by lab test.
No matter where you were, the headlines were the same.
It's another record-setting day for La Crosse County.
Local healthcare professionals say lives are on the line.
It's turning into a horror story.
It's stressful here. It's hard.
Then came possible solutions and protests.
Things like these are going to be still recommended until further notice.
On Friday morning, people gathered in Toma to protest mask mandates.
The COVID-19 vaccine, like all other vaccines, has been scientifically reviewed and approved.
Now, nearly 3 years later, there may be an end in sight.
The ending of the public health emergency on May 11th ends a lot of the triggers for a lot of federal and state resources to be available to the communities that the states serve.
For people with private insurances, COVID test kits may cost up to $140. Resources like the state's free 2 at-home COVID tests per month could run out by the end of May.
Those are in existence until supplies run out.
Wisconsin Department of Health Deputy Secretary Deb Standridge says the best way to stay protected is to be vaccinated.
The main message is that people need to take care of their health. They still need to be aware that COVID does exist in the United States. It exists in our communities.
While life in 2023 may look like it's back to normal, Standridge says the virus isn't going anywhere.
While we know that COVID is going to be part of our lives going forward, it doesn't mean that we turn a blind eye to it.
Standridge says the Department of Health will continue to track COVID-19 cases, but updates may be weekly or even monthly. Ken?
Dua, thanks very much. Now, La Crosse County Health Department says local changes to pandemic programs may come in the following weeks.